Hi, and welcome to Untitled Healthcare Solutions webinar, Beyond the Basics, 5 KPIs to measure your practice's financial health using NextGen PM. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Attentive. Before we dive into today's webinar, I want to take a moment to explain the process for the presentation. First, I'd like to mention that this webinar will be recorded, and that we'll send out a copy of the slides along with the recording within the next week. Next, for those of you who aren't familiar with Attentive, I wanted to share a bit of who we are with you. We specialize specifically in NextGen healthcare and are passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we basically do everything NextGen. We also have some add-on productivity solutions for NextGen, including ChartGuard, Refund Manager, Unapplied and Deposit Manager, and Multiple Encounter Billing Manager. Next, I wanted to mention some upcoming webinars that we have planned for you soon. First, tomorrow, we're going to be presenting a brief demo of ChartGuard. ChartGuard is a NextGen add-on product that we created. It's a downtime solution for NextGen that ensures that you can always access your patient charts, even during a system outage. If you're interested in seeing that, drop me a note in the questions panel and I'll get you set up. Also, towards the end of the month, we'll be presenting an educational webinar that's a deep dive into NextGen's patient experience platform. We're looking forward to going over NextGen's new PXP platform, including features, functions that will benefit your practice on the new platform. We hope to see you there. Okay, so back to today's webinar on the 5 KPIs to measure your practice's financial health using NextGen PM. At the end of the presentation, we'll open the floor up to questions for you. We'll answer all the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Lindsay Lanning is Attentive's Healthcare Compliance Consultant, and Helen Lively is a consultant with us as well. So Lindsay, let's jump right into it. Feel free to get started when you're ready.
Great. Well, thank you, Chelsea. And hi, everyone. Thank you for joining us today to review the 5 key performance indicators to measure your practice financial health using NextGen PM. I don't think we could have picked a longer title, but it is very descriptive of what we're going to go over today. So whether you've been using NextGen for years or you're brand new to the system, this webinar will help you understand how to actually use NextGen practice management and its reporting capabilities more efficiently and effectively. So we're going to show you how by reviewing helpful PM reports and actually how to take them a step further. So what made this possible, is working with our clients over the years. We've come across a multitude of reports that we found actually provide greater insight into your practice operations and financial health. Most of the time we find ourselves on site assisting these clients, and we're using NextGen PM reports as a base. But then we're going a step further. We're manipulating them in Excel to get the numbers we really need. And we realized a lot of people don't know about these magic manipulations that we're doing, and we think you should. So we look forward to sharing those with you today. So it is important to note this particular demonstration or presentation may be a bit more advanced than you're comfortable with if you are actually brand new to NextGen PM. With that being said, we did have a great previous webinar on our events and education page of our Attentive website. It's called the PM Reports You Never Knew You Needed. The introduction and the explanations in that webinar paired with the insight and application from today's presentation, I would say may just end up being your little NextGen PM security blanket that you can't live without. I'm really hyping ourselves up today, but moving on here and kind of to get started. Now, I'm sure this goes unsaid, but why we're presenting on this today is because the crucial component PM reporting plays or should play in your practice operations and overall financial health. So running practice management reports on a regular basis is a key factor in maintaining a healthy revenue cycle. Reports provide practice oversight by identifying areas where you may be, unknowingly losing income. And there are many types of reports, each of which will provide a different lens through which to view your practice. So let me reiterate that there are a ton of reports you can choose from to keep an eye on how your practice is actually doing clinically and financially. Deciding which ones are best for your needs and then committing to incorporating them into your regular workflow is actually the key to success here. So specifically today, we're going to take a deeper dive into what those reports look like, how to manipulate them, and what translating them into accessible and understandable measures can do for your practice. So basically, today is all about taking you through what you already know and then going one step further. Now, the advantage of today's webinar is that we have the consultant's perspective on how these tips and tricks will improve the current state of your practice, combined with the fact that we also have these consultants on the line for questions at the end. So we had to pry her, deep out of RCM land for an hour or so. So use that questions box if anything comes to mind throughout the presentation that Chelsea mentioned. It's also important to note that someone is more than likely running these PM reports already in your practice, but don't assume you're all set up and sign off early. Unfortunately, we found many practices actually don't use all the reports that the NextGen system offers to their fullest potential. So physicians or maybe office managers may not know about NextGen's more sophisticated reporting capabilities, or you might not realize all the different ways you can use one report to gain different information based on filters and settings. So the goal of today is that you leave equipped to take your PM reporting to the next level with the ability to measure your practice's health by using KPIs. So before we dive into those 5 KPIs that your practice should be running, we want to make sure the concept of a KPI is familiar to everyone. So a KPI stands for Key Performance Indicator. We'll call it KPI from here on out, just for length purposes. But it is a measurable value that your practice will pull from the reports that we outlined today. And they can be used to compare your clinical and financial data to other practices, any practice locations, competitors, as well as even state or national standards. So think of this as a true industry or gold standard that's pretty measurable across multiple entities. So let's move forward with identifying KPIs and NextGen EPM reports. So the 5 listed on this screen are what we're going to focus on today. We're going to show you how to create the necessary reports in NextGen PM and then how to translate that information into an actual KPI. So each slide is going to take you through what a KPI is, the industry standard that we think would be a good goal for your practice, how to run the report associated with the KPI, including what filters to use, and then how to calculate each final KPI value. Once we've taken you through the process of finding the KPI values, the next step is understanding the translation of that KPI and how, if necessary, your practice can actually improve on it. So I wanted to include a small disclaimer. This is just the tip of the iceberg in regards to KPI reporting. There are hundreds of KPIs that your practice could be tracking if they aren't already. So this presentation is really going to provide a great starting point if this concept is new to you. But if it isn't, or you're already working on this, we encourage you to take it a step further when you leave us today. And of course, if you need any help, we're always happy to assist. So to jump right in, our first KPI is days in accounts receivable, or AR. So I think this should be familiar to everyone, but basically its value is the days it takes for a charge to be paid by a payer. So the standard for days in AR should be between 25 to 30. Honestly, this is high for Itentive's interpretation of it. That's the industry standard. Ideally, you want to be around 20. So an important part of days in AR is understanding the different factors that go into it. For example, specific payers have specific payment guidelines. So Medicaid pays in 7 days. Blue Cross Blue Shield, it's 7 to 14 days. And Medicare is 21 days. So with that in mind, think about the types of claims your practice is most frequently sending out and see if those timeframes align with the number you're seeing from your days in AR KPI. Another thing to note is the format in which your claims are going out the door. An example, obviously paper claims are going to result in a slower payment, therefore a higher days in AR. So now that we know what days in AR is, the first step is calculating your days in AR to run the PM monthly report labeled change in accounts receivable. So you are going to be running it by line item because that will reflect the actual payer. Running it by encounter would only show the primary payers. So once you've clicked by line item, it will pull up the filters that you can apply. If you need a refresher on the different filters and what they mean, again, refer back to the previous webinar we mentioned at the beginning. So we're going to assume for today's purposes that you're all well versed in the PM reporting features and especially the filter feature. So the next slide is actually going to outline which filters we recommend using for the monthly change in AR report. So here are the parameters you should set in the filter pane. This screenshot shows a great example of what it will look like when the system prompts you to filter your report. You can see, for instance, we're on the column setting in the screenshot. PM reports, have default columns already selected to display on the report, but you can, add these, you can remove these, you can reorder them using those blue arrows on the side. You can even modify column names by right-clicking it and typing in what you want to see on the report. Now, for calculating days in AR for this example, you'll only want to select charge amount and ending AR. Even if you have a specific way that you already like to run your monthly change in AR report, we do recommend following these filters regardless, because it's going to set you up in the best way to calculate your days in AR. So once you've selected the report and filtered it to the specifications we outlined, this is going to be the end report. Now, I would love to tell you that the fun stops there, but the whole point of today is taking what you know and going one step further. So one step further is translating these values pulled by that monthly change in AR report and creating a KPI. So I know you must be all on the edge of your seat waiting to see how to do this, but the process is pretty simple. It's something that can easily be factored into your weekly or even daily procedures. So with this two-step formula, you will be able to calculate your days in AR. I flash back to days in college or high school when they used to say plug and chug. It really is that simple. You're truly just plugging in the numbers into that, the numbers that you're getting from that monthly change in AR report, and you're chugging through this equation. It'll give you the days in AR KPI that you're looking for. So now what? You have a KPI that you've calculated, but what exactly does it mean for you in your practice? So simply put, days in AR represents the average amount of days your facility has outstanding charges that are waiting to be paid by the responsible party. So if you recall from earlier, we said the industry standard's 25 to 30, but there are multiple factors that go into it, such as payer timeframes and claim format. The lower your days in AR, the quicker you're being paid, and the quicker you're being paid, the better overall financial health of your practice. So we recommend that this KPI is something that you monitor monthly. However, if your practice has the bandwidth, there's no such thing as too much KPI monitoring. Now, let's say hypothetically you've run your reports, you've completed your calculations, and the number staring back at you is not what you want to see. How do you improve it? So consider breaking your report down by payer. If you can hone in on one payer that's causing your days in AR to increase, perhaps you could find a specified solution that would improve your final number. Or what about self-paying patients? What is your process for bill pay? Is there a way that your practice can make it easier for your patients to settle their balances? Is it time to consider, evaluating an online bill pay solution or even improving upon the one you have? This one might be, the most obvious one, but what is the process that your practice has in place for sending claims out the door? If your days in AR is too high for your liking, consider submitting claims, more frequently. So all of these small insights could possibly make a huge impact on your financial health over the long term. Another great application of KPIs is the ability to benchmark your data in comparison to facility and industry standards. So benchmarking is a great way to see where your practice stands when you're comparing, yourself to practices of similar size in a similar location or of a similar specialty. And actually, MGMA provides great resources to find benchmarking data. It's easily accessible on their website right now. So now that we've covered days in AR, our next KPI for today's presentation is AR percentage over 90 days. Sounds wordy, but it's incredibly insightful. So AR percentage over 90 days, this is going to highlight the percentage of your days in AR that is over 90. AKA, how much of your outstanding balances are older than 90 days. Obviously, we would want this number to be as low as possible. Anything over 90 days has the potential to turn into bad debt, which would result in little to no payment. So monitoring this is crucial for financial health. So again, the industry standard is 15 to 20%. But similar to days in AR, that standard's too high, for our liking. We tell our clients and your practice should shoot somewhere around 5 to 10%. So, side note, as we work through these 5 KPIs, we're going to follow this same process that we did days in AR KPI. We're going to show you the report to run, the filters to set, and then the calculations to work through, just so you kind of know what's coming for each one of these. So now that you know the flow, here's how to generate the right report for calculating AR percentage over 90 days. The most important thing here is that it might be tempting to run it, similarly to the days in AR report by going to monthly, then accounts receivable, but that isn't the best course of action. Running the specified accounts receivable report by collections and then by insurance aging analysis will be the right way to take with this one and the correct course of action. So the filter recommendation for this one is to make sure that you aren't including patient names. More important on this report is the way you have the sorting set up, which we'll show on the next slide. So as you can see, we've sorted the report by location and payer and filtered the age categories by 90 to 120, 121 to 150, 151 to 180, and then 180 plus. So in order to find the AR percentage over 90 days, you're going to need to take the line item amount column and divide that by total AR. This will give you your percentage over 90 days. You can actually drill down this calculation any way you want to. So you can do it by payer, by rendering provider. I've had clients do it a lot of different ways. And you can also do this process to find AR percentage over, let's say, 120 days or 180 days. You can keep going out with that. So this is a very dynamic report. It can result in a lot of insight for your practice. So consider having a conversation about what do you want to see and what makes the most sense to focus on. Again, we recommend percentage over 90 days as just a starting point, and we encourage you to continue on with your KPI findings by taking it one step further with looking at that percentage over 120 days or 180 days and breaking this down. So again, you did the work, you have this number in front of you, but what does it actually mean? So AR percentage over 90 days means there may be some troubling accounts out there that are hindering your practice's financial health. Again, the sorting of this report can allow you to manually drill down whatever you need to see in order to create these solutions for your practice. So again, this is a great stepping stone after incorporating the days in AR because it adds another element to why you have outstanding charges. Now, again, what if this KPI metric isn't exactly, where you need it to be or where you expected it to be? Consider the conversation, we just had about days in AR. How can we improve that? Your approach should be similar to each. Address the process you have for sending claims out the door, compare it to your payer schedules, and make sure your staff is on the same page of best practices for billing, and your KPIs should improve for both of these. There could be another added element to this, and that is the possibility there's a configuration on your end that's being rejected by clearinghouses. So comparing what you're sending out the door to what is being received by the clearinghouse could add a safety net of making sure your claims are crystal clear and ready to be paid. I think we all know, clean claims are the first step in efficient billing. There could be something in your NextGen configuration that's hindering that process as well. So be sure to consider that as a possibility if you find your AR percentage over 90 to be, slightly concerning. All right, well, we have now covered two, pretty, intense accounts receivable reports with calculations that, hopefully can give you some insight as to why encounters have outstanding balances once they're billed. But what about the encounters that aren't billed yet? So I'm going to go ahead and pass it off to Holland to take us through our, next 3 KPIs and their corresponding reports. So Holland, it is all yours.
Great, thank you, Lindsay. So as Lindsay mentioned, our next KPI is going to take a look at unbilled encounters. So what are unbilled encounters? It's as simple as saying they basically are what they sound like. They're encounters that have not gone through the billing process. They are on the patient's account and are part of the AR. However, the claim has not been created or sent out the door yet. So similarly to how unbilled encounters are exactly what they sound like, running the report is pretty word for word too. So you're going to go to that accounts receivable, unbilled encounters report, and it's going to generate a report of encounters that have accounts associated with them, but have yet to be sent out for payment. While getting to the report is fairly easy, making sure that you have the parameters set up correctly is arguably the most important part. So above are the filters that we recommend using for the Unbilled Encounters report. We're going to show an example on the next slide, but each of these is what contributes to the readability of the final report and helps to understand what that report truly means for your practice. For example, sorting it by ascending date will let you see the oldest unbilled encountered first. This could be an anomaly, but there also could be a reason for why this particular encounter is still unbilled, and that reason could be affecting other encounters in your system. So the finalized report should look something like this. And as you can see, the oldest report is showing up at the top. Now, this is a screenshot from a test environment, so hopefully you won't have any encounters from 2013 that are unbilled, but it is possible. So after analyzing this report, you would be able to identify which patient accounts, even payers and encounters are unbilled, and hopefully implement whatever process your facility has in place to get those claims out the door. So now that you have the filters and you have run the report, it's easy to see that ideally, unbilled encounters would be 0. The industry recommends that you run these reports at least weekly. However, it is a fairly easy report to generate, so if given the time, it can be run daily. Keeping an eye on unbilled encounters is an easy solution to resolving missed charges. Making sure all your claims are getting out the door is a surefire way to improve your financial health, and this KPI report is what highlights exactly how to do that. So let's say you see this and it's not exactly where you need it to be. What if your unbilled encounters are racking up? Why could that be? There could be a physical issue, but there also could be a back-end issue. Is your BBP job failing? Figure out why. There may be an instance in which you need to implement paper billing. These considers are practice specific and should be talked over with your team, but drilling down repeat problem areas should ensure your unbilled encounters report is as short as possible. All right, so for the next section of slides, we're going to focus on a few other KPIs that can be ran on a more regular basis, even daily, if you think that that's something that your practice can handle. So charge lag. This is going to be the 4th KPI report for today's discussion. But before we get too far into this, I want to highlight there is an important difference between charge lag and payment lag. Luckily, we are going to cover payment lag next, so keep in mind while we work through these that there is a difference. Okay, we have that covered, but what is charge lag? Basically, charge lag means the amount of time between when a patient is seen and when they're charged for their service is entered into the patient account. So running the charge lag report is as easy as following the report path from daily to charges. Again, we're going to have recommended filters to set on that filter pane for the report. I'll go over that in the next slide, but this is probably a report that you're already familiar with, much like one of them previously. So the recommended filters for this report are easily customizable for what your practice wants and or needs to see. For example, you may only want to look at the previous week, in which you would filter the create date field to specify those requests, or you may want to group it by location to manually drill down your data. Again, the point of these recommendations is so that you can get what your practice needs out of the reporting functionality. The customization feature is just an added bonus to implementing these KPIs to your already established reporting process. So your finalized report is going to look something like this. And this is going to happen after you've specified your reports to those parameters that we set up in the last slide. But the next step, again, the whole KPI process is about taking that next step, is going to be exporting this report to an Excel file. This is done via that icon at the top that we have highlighted in red. So a pro tip that our consultants have seen over the past few years in the industry, the best practice is the arrangement of the columns. Specifically, the exact order that's shown is going to make the most sense once we export that Excel file and create that calculation to find that KPI value, which we're going to show you. So, as I mentioned before, exporting this report into an Excel file is how you create that KPI. So once you've exported, you're going to create a new column for the lag calculation and then insert a formula, create date minus date of service, and that's going to result in the column that highlights the charge lag days for each encounter. I know, math. So here is a great example of what that Excel file is going to look like. So as you can see, we've selected the Excel cells that we want to use for the formula in the new column, and then we've used that equation that we highlighted before to find the charge lag days for each encounter. So the great thing about this export feature that NextGen provides in its reporting functionality is that Excel also has great functionality. So once you've exported this file, you can use any filter, any customizable filter on Excel to highlight over 30, 100, really whatever highlight that you think would be beneficial to see as a practice. But there's just truly so many options once you export that into Excel to see what you can do with it. So just like the previous KPIs we've covered, there are considerations to make if you think that your charge lag days are a little bit higher than you prefer. For example, if you're doing charge capture from the EHR, making sure that your providers are keeping up with entering charges in a timely manner, possibly even daily. Consider, are you using the holding tank? You have to make sure people are processing charges from the holding tank. So keep in mind, using the BBP and making sure that all of that is set up will help as well. So when you're thinking about the charge lag, there should be policies and procedures in place that your staff is aware of that indicates an allowable charge lag time. So for example, 3 days could be set as a predetermined location standard, but that means that anything after 3 days should be addressable in a fashion that identifies the problem and has a feasible solution. So last but not least, we are going to cover the payment lag report. So as promised, like I said, there is a difference between charge lag and payment lag. So going over this should help highlight the differences. So just again, mental note, big difference. So in its simplest form, payment lag is the amount of time between the time the charge was billed to the payer and the time the payment is entered. So the process and filters are going to be similar as we work through this final KPI, but there are small differences that result in a different end report from that charge lag. So running the payment lag report is as easy as following that daily, again, by line item, and then to payments. So similarly to the rest of the reports, again, we do have those recommended parameters in the filter pane. I'm going to go over it, but again, just following these pathways and these filters are what will create a KPI in the best practice for your facility. So above are the filters we're going to recommend using, but most importantly, there is an interchangeability factor of the post date, the process date, and the transaction date. This would be practice specific as to how they prefer to run the reports, but in the end, as long as you're doing what is best for your practice, you're going to get meaningful results. So just to note, filtering by first bill date sets up the report so that it is factoring in the date the encounter was first billed. This is what you will subtract from the transaction date in order to get your payment lag. So again, the process for finding that payment lag is the same as the charge lag. You're going to be exporting the file into Excel, creating a new column for your payment lag days, inserting that equation, subtracting the first bill date from the transaction date, and you will find your payment lag days. So again, the functionality of Excel, once the report is exported, is completely up to your practice. There are a multitude of options to make this Excel file highlight, indicate, anything that you would need, any sort of outliers for your payment lag KPI. So the most important consideration for payment lags is looking at how often your facility is posting batches. This should be something that is done every day by whoever is responsible for posting payments, but obviously you may need to factor in human error. So again, this is best practice. Not doing so is what could result in that payment lag. So now that we've covered the process of what it currently takes to report and calculate these KPIs in NextGen PM as the system is currently configured, wouldn't it be great if there were a tool that could automate this process? It could take out the highly manual nature of running these reports daily. Well, I have some exciting news because lucky for us, this does already exist. NextGen has a new application called NextGen Financial and Operational Analytics. So it's been revamped and includes operational reports and visualizations to help monitor your practice's financial health. So now I'm going to turn it back over to Lindsay to talk more about this product and what it's capable of. Lindsay, it is all yours.
Perfect. Thank you, Holland. So I will say I'm not a complete expert on this tool here. I've sat in on demos. I've been able to talk to NextGen, specifically one-on-one about this and its capabilities. There are demos out there. There's information on the success community as well. So we pulled a lot of that information from demos we've attended and also from the success community. But it is extremely useful, and you might have heard about it before when it was actually just called NextGen Financial Analytics. They have now kind of revamped this and have also included operational analytics as well. So what is NGFOA? Besides a very long list of letters that I have to slow down to say out loud for some reason. I can say it fast in my head, just not out loud. NextGen Financial and Operational Analytics, it's a web-based tool that's going to enable NextGen clients to quickly view financial data and operational performance trends across their enterprises and practices. So instead of using detailed reports, data is actually going to be presented in graphical formats that are referred to as visualizations or charts. So NGFOA actually extracts data nightly using the data pump via a scheduled job, and it runs for approximately 10 minutes. And data in NGFOA is as current as the previous day of business. So again, this can be accessed via web browser, even on your mobile device. And the solution is easily customized to reflect user preferences. So upon logging in, users are going to be directed to the home page, which is what you're seeing on your screen now. Again, you might be able to tell some of these screenshots were either taken from the guide or from demos ourselves. So I apologize if they're a little bit blurry on your screen. But here on this kind of home screen here, you can quickly explore trends. You can use drill down navigation and look at these kind of granular data elements in a much more, visual format versus looking at raw data from a report or, like black and white data in an Excel file. So this is going to simplify reporting, by automatically gathering data from multiple sources, allowing you to develop dashboards and visuals for relevant metrics, and then actually drilling into reports for that crucial information. So this seamless flow of reporting and analytics will actually allow you to access and also understand the data you need to thrive and make those, critical data-driven decisions in the healthcare marketplace. As it stands, right now, this product can pull over 100 different KPIs into that display. Again, we only went over 5 today. So this is extremely helpful when trying to communicate with those at the executive level. That's where we've seen it most, is kind of almost bridging that communication gap between those who are, daily users are really in the trenches, your office managers, those on your actual RCM team, bridging that communication gap with that C-suite, that executive level, that upper management, who want a bird's eye view on how the practice is doing financially, who don't want, those black and white data reports or where they have to actually look at those and understand and interpret those. That's really where I've seen this tool thrive. So here's just a portion of the automatic KPIs that NGFOA can provide. Like I said, NextGen offers more than 100 different KPIs to report on, and all 100 of those, or plus 100, I should say, they primarily fall into 5 functions or buckets. So those 5 are, the first one, AR. Think rolling AR credits. I've seen patient or insurance AR. Those are just some examples. You've got billing is another bucket. So think things I've seen are like unbilled charge amount, and then various different charge lag, KPI, either by charge creation or encounter billing. The next bucket would be denials. So think some of the KPIs I've seen with that is like gross denial and recovery amounts, billed amount, denial amount, the counts, etc. The fourth one was actually, I believe, payer analysis, but also tasking. So this is going to include things like your E&M counts. It'll also track, the number of tasks that were created versus which ones were completed, etc. And then the last kind of bucket that these KPIs fall into are payments. So these are going to include KPIs such as charges, payments, and adjustments by process date. Trying to think, they had RVUs performed or even like a gross payment percentage. So again, these are tons of options with this tool. I have by no means named them all. But with this tool, having that automation of the KPIs that we discussed earlier, right at the tips of your fingertips, right at the tips of your fingers, and having that data refresh on a daily basis could mean a more automatic and seamless, financial reporting process, not to mention obviously the convenience and time saving factor as well. So the capabilities with this application that I tend to think are really exciting is, not only that data visualization tool, but the drill down capabilities that are available, and also the automatic benchmarking on certain KPIs. So what do we mean by data visualization? Well, the graphics on the homepage are carefully crafted, location-specific data. They represent, to look at these representations of this data and can be used to actually uncover trends and communicate big ideas, all while being backed by that hard real-time data you need. So this is the beauty of data visualization. It takes hard data and translate it into an understandable and shareable graphic that you can speak to. As well as the data visualization, that drill down technology that NGFOA has enables the user to drill down the visualization to a deeper and more detailed level when applicable. So paths for drill down, they're going to vary by chart, but for example, you may be able to drill down by date. You could drill down by practice, by location. Specialist has been a big one, even by provider and by payer. And there are plenty more options to drill down. Those are just some examples, and it does depend on the specific chart. So if you can recall from earlier in the presentation, again, we mentioned benchmarking your days in AR to other facilities data. And we recommend going to MGMA's website and finding that data by doing your own research. But the functionality of NGFOA does this automatically for some of those KPIs in its reports. However, because it is an internal NextGen application, the data you're benchmarking against is actually limited to other regional NextGen practices, which I found a lot of clients prefer and like. They're using the same system, they have the same capabilities here, features and functionality. So you're getting a clearer picture of what other NextGen users, what their RCM, both financial and operational practice health look like. So this is still going to give the user greater insight to where you all stand in comparison to other NextGen facilities in the area, and it could also highlight potential room for improvement. So now that we've covered what a KPI is, how to report on them with the functionality that NextGen PM currently has, and the potential for an automated solution, we hope you leave today feeling encouraged to take a deeper dive into your practice's RCM health. I know KPI reporting can seem tedious, but the benefits to truly understanding your facility's day-to-day operations through the reporting tools that NextGen PM already offers is the first step in maintaining a financially healthy practice. So, we wanted to end with a little food for thought. We are ending a little bit early today with the expectation that we would have some questions to go over here. But the quote I'll leave you with is actually from the former CEO of HP. And she says, reporting turns raw data into information that can be consumed by a company. And through analysis, you turn information into insights. So I hope through this webinar, you've discovered some new reporting functionality, and you're now seeing some of those old reports from NextGen PM in a brand new light. So we're going to go ahead and move on to next steps here. As always, if you're uncertain where your practice stands, let I-10 help. We can assess where you're currently at. We can obviously provide, very tailored recommendations to your practice, especially, involving PM reporting, but also, the overall RCM operations and health of your practice. From this point forward, feel free, visit us at our website, i10f.com. Sign up or continue to sign up for our informative webinars. We have some good ones coming up, both on the PXP, but we have some other fun topics with NextGen coming out. To that same note, we've also been using our LinkedIn a little bit more recently. We might have a poll or two coming up to get your feedback on what kind of webinar topics you would like to hear about and you would like to learn about. You can also consider our 3-day fixed price on-site consultations. We do offer a clinical workflow. I wanted to highlight the revenue cycle in front office, as well as technology and performance. And of course, test drive our products. So I'm going to go ahead and turn it over to Chelsea, who will go ahead and look at the questions that have come in throughout the presentation. And I believe we have Deanne, one of our PM experts, on the line as well to help us out with those.
Okay, perfect. Thank you so much, Lindsay. And yes, we do have Deanne. She's going to be wonderful. She is a total subject matter expert on all of this, and we are excited that she's going to be able to help with some of these more technical questions. So we're just going to go through these in the order that we received them. Feel free to keep them coming in, and looks like we still have plenty of time, so yay. Okay, first question. Days in AR, single specialty or no regard to how many specialties? Deanne, you want to start with that?
Thanks, Chelsea. With the days in AR, you can use the MGMA to get the specialty, or you can just use the industry standard that Lindsay quoted, which was the 25 to 30.
Okay, perfect. Thank you so much. Moving on. If an account is held within an account check, is it considered aged? And by account check, I'm referring to claim edit.
Yes, on that one, the system starts aging the charge once it is entered. It does not take into consideration that it's unbilled or due to a claim edit.
Okay, perfect. Thank you. And Deanne, it looks like you already had to get some clarification on this question, so I'm going to read it and let you take it away. Would you be able to use the INS aging responsible balance report for the AR percent over 90?
Yes, you will be able to use that report as well to get your percentage of your 90 days. Those reports would give the same totals. It would just, the only difference is how they are line item out.
Okay, perfect. It looks like we've had a bunch of questions asking for the slides. I'm going to assume that's because they were so full of great information. You want to be able to reference them again and again and again. I will be sending out a link to the recording along with the slides to everybody who registered for the webinar within the next few days here. If you registered with a different email address than the one that you'd like to receive a copy of the slides and recording, feel free to drop your email in the questions panel and I would be happy to send it to that email as well. It looks like we already have a few of those, so I see those, so thank you for those people. Okay, what version of NextGen do you need to be on for the NextGen or for the NGFOA?
I can grab that one. I don't know, Cindy, are you on the line?
Yeah, I actually was able to get back. That has actually been around for a while. I believe, though, with NextGen acquired it, it was really a third-party product that they worked with and incorporated, and it was, worked with some of the larger clients. So they've incorporated that with a couple of other things. So I'm thinking if you're on anything 5.9 and up, you should be fine. I might even go a little bit lower, but if you're on anything lower than that, you really should be thinking about upgrading anyway.
Okay, thank you, Cindy. Next question. How is NGFOA accessed?
I can grab that too. It's an optional module, so if if it's something, I'm looking at the questions right now. I believe that you're, if you're with a reseller, like I10 is also a reseller, we're also a consulting firm, so you could reach out to us for pricing if you were one of our reseller clients. If you are with another reseller, you would reach out to them, and if you're a NextGen direct client, you would go to your account executive and get a quote. It's an optional module, so they would want to take you through it and take the pricing. It's not something you can just turn on or off. You have to purchase it.
And it's a web-based application, so this is something you're actually going to go online and log into, similar if you use the HQM, how you open up a web browser and access it that way.
Great, thank you everybody. That was a great communal question. Okay, next question. Hi, this is in regards to the unbilled encounters report. We have many encounters that are duplicated. What's the best way to handle the duplicate encounter to separate it from truly billable encounters? Deanne, do you want to grab that one?
Yes, I was wondering if they're having duplicated encounters because one has a zero balance and the other one has an actual charge balance on it. If that's the case, then in your filter, you can add your charge amount to be greater than zero, and that would drop your duplicated one that doesn't have a charge on it.
Okay, perfect. Next question. Are there any FQHC specific KPIs?
So I can grab that one. The specific, NGFOA and also, KPIs in general, they don't really break them down by specialties specific. Obviously, I think some of the operational ones would apply to all specialties. If you're looking at visits per provider, if you're looking at, task creation and utilization and what was completed. Also, financial, I think, would still apply to FQHC if you're looking at days cash on hand, patient utilization, things like that. Those financial and operational, I think, would span all specialties. They don't call anything out to be very specific FQHC oriented. Cindy, I don't know if you have anything to add.
Yeah, I would like to jump in on that a bit because while in certain aspects of it, but many of your FQHCs, it would have to depend on, all of your participation, but FQHCs are largely Medicaid, and you typically will have a different cash performance index associated with some of your, depending upon if you're more a fee for service, some groups have a combination, some groups are more charitable based. So we would really have to look at that individually. I'm sure, there are standards out there. So I would actually answer that question, yes, but it's not the general KPIs that you might think about from a NextGen reporting perspective. You want to narrow your data down specifically based on your performance and your comparative tools with those. I do know that with the some of the tools that are out there, and then some of the NextGen FQHC specific products that are coming out, they have some initiatives associated with that. So Lindsay's correct. The standards will still apply, but there are industry updates that you would need to consider, and also some of your own internal policies in terms of how you might want to look at that and measure your progress.
Okay, thank you, Cindy. And it looks like this may be our last question. So if you have questions, feel free to type them in and we'll hang out and answer them. Okay, so Lindsay, it looks like maybe this is a question for you. Can benchmarking in NGFOA be done by location?
So great question. Right now at this very time, benchmarking is actually only be available at the enterprise level. NextGen has stated though that they are exploring revisions to benchmarking that would include this though, and that was months or so back. So I think that's down the pipeline, but as of right now, it's only available at the enterprise level.
Okay, thank you, Lindsay. And again, thank you everybody for joining us today. If you have any more questions that you think of, feel free to reach out directly to us. You can either reply back to the email that I'll be sending with the slides and the recording. You see both Holly and Helen's and Lindsay's information on the screen. You can reach out to them directly. Basically, any way that you can get a hold of us, we're happy to help. That's why we're here. So don't hesitate to reach out to us. And thank you all for joining us. I hope that you have a great rest of your day and a great week.
Thanks, everybody. Goodbye.
Thank you.